This is what the heart attack looks like.
If you hear the word heart disease and don't think it applies to you, listen to this.
It is the #1 killer for sure by a long stretch.
Heart disease is the leading cause of death for men and women in the United States. Even if you don't have a history of heart disease, you could still be at risk. According to the American Heart Foundation, heart disease claims more lives than all forms of cancer combined. In fact, in the U.S., there is a heart attack every 34 seconds, and every 60 seconds, someone in the U.S. dies from a heart disease-related event.
Welcome to a KSL5 News Special Edition, examining your life, your health.
Thanks for joining us tonight for this special edition of Your Life, Your Health. We're tackling a sobering topic tonight, heart disease. Chances are you or someone you know has been affected by a heart-related illness. In this next half hour, we're going to explore the signs and symptoms to look out for, and we'll reveal the 7 key health factors and behaviors that increase the risk for heart disease. We hope by the end of this half hour, you'll take a closer look at your health and pledge to make one simple change to better protect yourself. We begin tonight with one woman's story, a Utah mother and grandmother who knew for years she'd need open heart surgery to repair her rheumatic heart. Here's news specialist Heather Simonson.
Mother of 3 and grandmother to 7.
Hi, Ms. Thompson.
Good morning. Linda Thompson is facing a surgery that's been a long time coming.
You actually have 2 of your 4 major heart valves that have become fairly tight and causing your heart to have some problem ejecting blood.
Linda's heart was damaged after having rheumatic fever as a child. Surgery is now the only way to restore her heart's natural function, reduce her risk of stroke, and prevent heart failure.
Yeah, it's a scary operation, but yet I am glad in a way to have it not hovering over my head.
A condition slowly decreasing as our population ages.
Our incidence of rheumatic heart disease is decreasing across the country, and in the operating room, we are finding rheumatic heart disease to be less common.
Pericardial, please.
Linda's condition worsened over time to the point where she was feeling nauseous and having trouble breathing when out walking. Just one of the many things she looks forward to enjoying again after this crucial surgery.
Well, I'm hoping that I can go back and go back to my normal routine.
When all is said and done, Linda will end up having 2 heart valve replacements and 2 bypasses.
You're charged at 20.
During surgery, one of Linda's ventricles failed.
20 delivered.
Dr. Mitchell placed a balloon pump to fix it. All in all, spending a grueling 10 hours in surgery.
Keep that spine nice and tall. Keep that really close.
Go back close. I forgot that.
After surgery, patients come here. Dr. Mitchell says it's the most important part of their recovery. Through cardio and strength training, they can do the things they love again.
It's going really well. I'm feeling a lot better. Week by week, I notice that I've gained a lot of strength. I'll stop there. Oh, okay.
A few weeks of physical therapy, and Linda is feeling stronger than ever.
How many minutes on the treadmill?
40.
Awesome.
Yeah.
Wonderful.
A new beginning to a long, healthy life ahead, adding even more precious time to spend with her children and grandchildren.
You know, you think of them and you think of what you still want to do with them.
That's why this is so important. When you think of the symptoms leading up to a heart attack, you might picture the big, crushing chest pain, but only 20% of women have those classic Hollywood symptoms. Women don't always recognize the symptoms associated with coronary artery disease. Most experience abdominal discomfort, back pain, nausea, and fatigue. If you've experienced any of these symptoms on a regular basis, especially over a shorter period of time, you should have a talk with your doctor and be honest about your symptoms. Now, let's move on to congenital heart disease, or CHD. This type of heart defect or abnormality is discovered during pregnancy or shortly after birth. Nkoyo Iyamba introduces us to a spunky little girl faced with this challenge who brings nothing but strength and life to those around her.
I'm supposed to die. Hey, buddy, I'm it.
You're it. Haha, you better run away. She's...
Oh, let's go.
Let's go. Really funny.
That's cool.
And she's super weird. She's very helpful. She loves her baby sister.
You're going to be so tired.
A.
3-year-old Eiley
I
was born with a rare heart condition.
The nurse heard
a heart murmur.
Only 1% of children are born with congenital heart disease.
She was born with tetralogy of Fallot, with pulmonary atresia and MAPCAs. So basically she was born without a pulmonary artery or valve coming out of her heart.
How you doing, sweetie?
In Utah, doctors see only 4 to 5 of these cases a year.
So Eiley is a very fun patient for me. So I met her when she was 4 days of age.
3, huh? I can't believe it's been 3 years ago that we met you in the hospital.
And she's been my patient since.
Can we listen to your heart a little bit?
She had an initial surgery at about 3 months of age where they closed a hole that was between the 2 pumping chambers in her heart, and they placed a prosthetic or man-made pulmonary valve in her heart.
It was horrifying. Those first 3 months of her life were very up and down.
The first surgery was a 12 or 13 hour, really extensive surgery. Did you have a surgery?
Yeah.
What did you have a surgery on?
On my heart.
Does your heart feel better after the surgery?
Yeah.
Yeah, it feels so much better, huh?
Yeah.
Once you've been through it once, I think it prepares you for the next times. It's been hard, but it's good that you have good people to take care of the condition.
A condition Eiley will have to live with for the rest of her life.
5, 6.
But beyond the doctor's office, that life is filled with laughter and a big imagination.
She's a joy to have in our house. We love having her.
Eiley is scheduled to have another surgery in May. She'll have more procedures down the road to keep up with the size of her growing body. As of October of last year, the state legislature mandated that all newborns will have a congenital heart screening before being discharged from the hospital. While we're on the topic of children, we want to quickly address childhood obesity. The rate of obesity in children and adults in the U.S. and even here in our state is increasing at a fast rate. Children are increasingly being evaluated for high triglycerides and high blood pressure. Those are the same types of cardiovascular problems you'd normally see in the adult population.
We're starting to see those happening earlier and earlier, most likely related to diet and other lifestyle.
Dr. Hoffman says the most important thing we can do is be a good example to our kids. Next, limit screen time. Encourage and provide opportunities for kids to be active. Help them find their passions so they can enjoy living an active and healthy lifestyle. And don't forget to encourage them to eat the recommended 5 servings a day of fruits and vegetables. I know that's tough. If you can focus on healthy choices, then you can eliminate poor food choices down the road.
But I never crossed my mind that I have a heart attack.
Quick thinking by his co-workers not only saved his life, but set a record. And just seven habits and behaviors to better heart health. The countdown begins in just a few minutes. Heart is an amazing muscle. Here are some interesting heart facts. The adult heart pumps about 5 quarts of blood every minute and about 2,000 gallons of blood a day throughout our bodies. Your heart beats about 100,000 times a day, and it only takes 20 seconds to circulate through your entire vascular system. Stress can really take a toll on your heart. Combine stress hormones with the rise of blood pressure and increased heart rate, and you have the perfect recipe for a heart attack. That's why it's so important to reduce your stress levels as much as you can.
Get more active, take up a hobby or do something that gets you out of the chair and moving around.
Another thing you can do, that right there, take time to laugh. Heart experts now have proof that laughter is a good medicine. A good belly laugh can actually send 20% more blood flowing through your entire body. So giggle a little. Your heart will thank you. Let's get back to our countdown. Knowing your numbers is key when it comes to maintaining a strong heart. We've talked about managing your blood pressure, cholesterol, and blood sugar levels. This last half of our Simple 7 countdown is now based around lifestyle choices. Number 4, get active. Living an active life is one of the most rewarding gifts you can give yourself and those you love. Simply put, daily physical activity increases your length and quality of life. Number 3, eat healthy. A healthy diet is one of your best weapons for fighting cardiovascular disease. When you eat a heart-healthy diet, you improve your chances of feeling good and staying healthy for life. Number 2 is lose weight. It goes right along with it. When you shed extra fat and unnecessary pounds, you reduce the burden on your heart, lungs, blood vessels, and skeleton. You give yourself the gift of active living, you lower your blood pressure, and you help yourself feel better too. And then you see the number 1 that rounds out our countdown: stop smoking. Cigarette smokers have a higher risk of developing cardiovascular disease. If you smoke, quitting is the number 1 best thing you can do for your health. The best ways to take care of your heart and what you need to know if you have a family history of heart disease. We'll tell you when you should go in for your initial heart evaluation and where you can get the best information on how to live well.
In Your Life, Your Health, we help you live a healthy life. Because what you know can improve your health. Turning on upbeat music while you're cleaning is a fun way to boost your mood and keep you moving. Cooking at home not only saves you money, you can actually burn up to 80 calories in 30 minutes.
Now, a word from our sponsor.
Sneaking in a little exercise during commercials can blast more than 100 calories in 30 minutes. The more you know, the better your health. Your Life, Your Health. Thursdays at 5 on KSL News.
Closed captioning sponsored by Same Day Heating and Air, the people who can, and the Big Green Van.
So to conclude, the best ways to take care of your heart is to know your numbers and find ways to be active, all while eating a healthy diet. If you or someone you know is experiencing any of the symptoms we've talked about, seek medical attention immediately.
If there's a strong family history of coronary artery disease, then that initial evaluation may come earlier.
The American Heart Association recommends your initial heart evaluation at the age of 40. There are many ways you can learn more about heart disease and to protect your heart from further damage. Your doctor's a good source of information, but take advantage of other resources as well. Dr. Mitchell recommends 45 minutes a day of continuous activity for good heart health and says it doesn't matter how fast you can complete a mile, but can you finish it? If you want to explore more ways to improve your heart health, visit intermountainlivewell.org, where you'll find healthy recipes, hikes, and a variety of activities and advice to improve your overall health and well-being. And remember, we're hoping that after this show, you will take a pledge to do one of those 7 things we talked about in order to improve your heart health. Thanks for joining us tonight. We'll see you back here at 10 o'clock.